Hello friends, today I am going to reveal some true facts about mindfulness. Mindfulness. But first of all, I request you to please share and subscribe my channel for getting my informative true facts videos uninterrupted. Mindfulness. The mind-body medicine program. The purpose of my presentation is based on the premises that the mind and body are intimately interconnected. They are interconnected. Utilizes techniques to optimize this relationship for improved health and well-being. Take mindfulness and teach mindfulness based on skills that can be integrated into daily life to reduce stress, manage pain, enhance sleep, strengthen positive qualities, and improve overall quality of life. Mind, body, and skills is important. Mindfulness means attention training to cultivate qualities of concentration, clarity, and equanimity, the common thread connecting all other skills. Relaxation. Relaxation is important. Techniques to elicit the relaxation response in mind and body. Yoga. Movement and breathing strategies to synchronize mind and body and reduce tension. Positive psychology. Practice to cultivate and strengthen positive mind, emotional states. Resiliency training. Techniques for balancing the nervous system, processing trauma, and strengthening the resilient zone. Now, what is it? Mindfulness means paying attention in a particular way, on purpose in the present moment and non-judgmentally. Mindfulness means paying attention in a particular way, on purpose in the present moment and non-judgmentally. Regular practice cultivates three core skills. Number one, concentration, the ability to focus and stabilize one's attention. Sensory clarity, the ability to keep track of the components of sensory experience as they arise in various combinations, moments by moments. Equanimity, the ability to be with experience with an attitude of gentle matters of factness. I will repeat this. Concentration, the ability to focus and stabilize one's attention. Sensory clarity, the ability to keep track of the components of sensory experience as they arise in various combinations, moments by moment by moment. Equanimity, the ability to be with experience with an attitude of gentle matters of factness. Many techniques are there for mindfulness. Depends on teachers and tradition, restrictive or open attention, and noting option also. Beginners practice. Restrictive focus such as breath meditation develops strengthens core skills of concentration, clarity, and equanimity. Intermediate, advanced practices are there. Open awareness to increasing amount of sensory experience such as choiceless awareness. Formal and informal practices. Where does it come from? In the 19th century, mindfulness was used to translate the Pali and Sati. Pali is the canonical language of Theravada, a form of Buddhism found in Southeast Asia. Establishing mindfulness, that is Sati Patthana. Sati Patthana is the primary practice of Theravada Buddhism. Sati Patthana is the primary practice of Theravada Buddhism. I am going to repeat the main points. It is said to lead an insight into the true nature of self and reality, impermanence, the suffering of conditioned existence and non-self. Mindfulness arrives in the West later on. In the 16th and 70s, Westerners began going to Southeast Asia to learn mindfulness practices. They brought those practices back to the West and began to teach them within the framework of Buddhism. In the 18th and 19th, it was discovered that those practices could be extracted from Buddhism and the cultural matrix of Asia and used within a secular context. Secular mindfulness. Mindfulness awareness practices started to be used within a secular context to develop useful attentional skills. These practices become ever more prevalent in clinical settings for pain management, addictions, recovery, stress reduction, and as an adjunct to psychotherapy. These practices become ever more prevalent in clinical settings for pain management, addiction recovery, stress reduction, and as an adjunct to psychotherapy. Mindfulness in healthcare, which is important. In 1979, John Kabat-Zinn created mindfulness-based stress reduction (MBSR) at the University of Massachusetts Medical School to treat chronically ill patients. Subsequently, a number of other therapeutic modalities centering around mindfulness were developed. Acceptance and commitment therapy (ACT), acceptance and commitment therapy (ACT), mindfulness-based cognitive therapy (MBCT), mindfulness-based cognitive therapy (MBCT), dialectical behavioral therapy (DBT), dialectical behavioral therapy DBT. Mindfulness in society. Increasingly, it is being understood that mindful awareness is a cultivable skill and broad application through all aspects of society, including education, prison, systems, and politics also, businesses, and even the training of soldiers. The benefit of mindfulness. What are the benefits of mindfulness? I am going to explain. Benefit of mindfulness. It changes the brain in positive way. It is important. It changes the brain in positive way. Overcoming fear and anger. Neuroplasticity. Recent research in neuroscience shows that we have the power to influence our brains. When we think certain thoughts, it strengthens those neural circuits. Mental states become neural traits. Self-directed neuroplasticity. Nurture positive states of mind to strengthen and build those neural networks. Make happiness a habit. The brain is like a muscle that we can build through practicing skills. Brain is just like a muscle that we can build through practicing skills. Pro-social behavior, impulse regulation, emotional awareness, compassion and empathy, and forgiveness. Mindfulness helps balance the nervous system. Stress response, central nervous system, perception narrowed, memory coarse imprecise, learning blocked, conditioning defense, tendency regress or preserved, tone fight or flight, muscular system tension, ready for action, jaw clench, and body braces for action. Automatic nervous system. These are stress response. Automatic nervous system. Heart rate increases, blood pressure increases, oxygen need increases, breathing rates increases, palms, face sweats, blood sugar increases, adrenaline flows, digestive tract shut down, blood to muscles, blood vessels constricted in hands, face. Relaxation response. The relaxation response is a physical state of deep rest that changes the physical and emotional response to stress and the opposite of the fight or flight response. The relaxation response is a physical state of deep rest that changes the physical and emotional response to stress and the opposite of the fight or flight response. Mindfulness improves self-regulation. The resilient zone. In our resilient zone, we have the best capacity for flexibility and adaptability in mind, body and spirit. Mindfulness helps deepens the resilient zone. It charge, release and charge. A stressful traumatic event or stressful traumatic triggers struck on hyperarousal. Hyperactivity hypervigilance mania, anxiety and panic raise pain. Let us practice mindfulness, breath focus meditation. Train the mind to settle, let go of mental clutter and focus in the present moment. Focus in the present moment connects mind with the body, correct? Mind with the body. Find a comfortable position, either lying down on your back in a chair or a cushion on the floor. Spine should be erect but not rigid. Scan through the body and release unnecessary tension. Scan through the body and release unnecessary tension. Bring attention to the body with an attitude of friendly curiosity. Bring attention to the body with an attitude of friendly curiosity. Tune with the sensation of your body breathing and focus your attention on the feel of the breath coming in and out. Tune with the sensation of your body breathing and focus your attention on the feel of the breath coming in and out. When your mind wanders, notice and gently guide attention back to the breath over and over again. Practice for 5 to 30 minutes daily for lasting positive results. Now, body scan meditation connects the mind with the body, increases ability to track body sensations, grounds attention in the present moment, increases insight into changing nature of sensation, trains the mind to tolerate sensation with greater equanimity, trains the mind to tolerate sensation with greater equanimity. Bring curious, friendly attention to the sensations in your feet, feels and think. Gradually move your way up the body, feeling the ankles, lower legs, knees, upper legs. Feel sensation in the lower back, middle back and upper back, buttocks also. Notice sensation in the pelvis, abdomen and chest. Sense the fingers, hands, wrists, forearms, elbows and upper arms. Feel sensation in the shoulders. Notice any tension without judging it or trying to change it. Notice sensations in the neck, throat, jaw and mouth. Sense the nose, eyes, forehead, ears and head. Feel sensation in the whole body at once. The whole body at once inverse of the sensation. The whole body as one inverse of the sensation. Regular practice. Take mindful pauses throughout your day. Take 1 to 5 minutes to practice slowing down, feeling the body breathing more fully, letting up of thoughts and returning to the present moment with gratitude and acceptance. Take 1 to 5 minutes to practice slowing down, feeling the body breathing more fully, letting up of thoughts and returning to the present moment with gratitude and acceptance. Set aside 5 to 30 minutes a day for meditation, yoga, art or other mindful activities you enjoy. Surround yourself with support. Get books, audio, phones, apps to learn more and keep you motivated in the practice. Take a mind-body class. Do a meditation retreat. In our next video, I will give some other details of mindfulness. Thanks.